advances in technology could help keep many of the 5 million Americans living with heart failure out of the hospital.
And joining us from Orlando, site of the Heart Failure Society of America meeting, is Dr. Jerry Estep. Hi, Dr. Estep.
Hello, thank you for having me.
Now, doctor, why has treating heart failure been so challenging up until now?
Treating heart failure is challenging for many reasons. There are many phases of heart failure based upon age, gender. It really doesn't discriminate against anyone. And the symptoms and signs can be subtle to more overt. But one of the main challenges is to identify the underlying condition that's associated with the condition. Screening for coronary artery disease, high blood pressure, underlying heart valve disease, to name a few. And I think the most important challenge is bringing up to speed those that care for these patients, from family practitioners to cardiologists to heart failure specialists like myself, where we want to ensure awareness of guideline-directed medical therapy, and importantly, devices and updates in technology that have helped us help these patients.
How is technology helping doctors manage patients better?
So technology is critical, and there is a clear role for devices in select patients that are persistently symptomatic, and we've learned half of all heart failure patients have a very weak heart, and we have criteria that guides us who may be a candidate for a device. For example, backup defibrillators can minimize the risk of dying from sudden cardiac death from an underlying lethal heart rhythm, which can happen at any time. So these backup defibrillators save lives. Many patients with this condition often have an underlying left and right lower chamber of the heart that's out of sync. And so with pacing configurations and a pacemaker, we're able to restore the normal energetics of the heart and improve quality of life, and for many, improve survival. And we have, as part of our tool set or toolbox, a specific device that we can easily place in the lung artery that detects the lung pressures, and we can monitor patients that are at home and act earlier in the process to change medicines to try to minimize the symptoms of heart failure getting worse and minimize heart failure-related hospitalizations. So that's an example of how devices are helping us tremendously.
And tell us, do you think closely monitoring patients can help them lead longer and more productive lives with heart failure?
So monitoring certainly helps us understand where a patient is at in that trajectory of anticipated progression. And some patients stabilize easier than others. But in particular, this device monitoring therapy, being key on watching the lung pressures, helps us improve or minimize the likelihood of having to go to the hospital. And that's a meaningful quality of life metric. Devices that can assist the left ventricle in the form of treatment for patients with more advanced heart failure actually helps us not only improve quality of life, but for those with end-stage heart failure, which is a diagnosis we don't take lightly, it helps us improve survival, either as a bridge to heart transplant for some. For those that have contraindications or reasons why we can't pursue heart transplant, therapy in and of itself.
Where can our viewers go for more info?
More information can be found at hfsa.org and heartfailureanswers.com.
Dr. Jerry Estep, thank you so much for that great information and, of course, for joining us on Coffee with America.
Thank you.